true. And we would say, for example, that the feet are inferior to the head. So superior means closer to the head and inferior means closer to the feet. Now imagine a line right down the center of your body, a midline, and the term medial will mean closer to that midline. So if we have a midline right down the center of your body, the term medial will mean closer to that midline, and the term lateral will be farther away from the midline. So for example, your hand is lateral to your chest, and your abdomen is medial to your shoulder. So your heart would be medial to your shoulders, and your shoulders would be lateral to your heart. The next terms are a little more difficult, and those terms are proximal and distal. So take, instead of the midline this time as your central reference point, this time it will be the heart itself. So proximal means closer to the heart, and distal means farther away from the heart. These terms work best in the limbs where we have something that's actually closer to the body and a part that's farther away from the body. But they can be used even in the head and neck. In the head and neck, distal would actually be the top of the head, and proximal would be the lower part of the head because it's closer to the heart. So again, what these terms mean is closer to the heart, proximal, and farther from the heart, distal.